our mental health services and advocacy is not only by providing yung mga teletherapy sessions or yung mga webinars, pero pati training sa mga leaders. Ano ba ang mga dapat nilang gawin as a leader to maintain healthy and safe and productive workplaces? And one of the biggest things rin na nakaka-change ng mind ng mga leaders natin kung paano tayo makapasok ng mental health policies and programs at work is pag data-driven tayo. Pag nakikita ng mga bosses, itong mga panawagan at shout-out sa mga horrible bosses na hindi naniniwala sa mental health, directly connected po ang mental health and ang productivity. At nakaka-apekto po siya sa bottom line. So meron po tayong data with Mind Nation. We've surveyed over 30,000 Filipino employees in the past 4 years, and we're seeing na for every 8 hours, 2 hours in a day of productivity is lost because of mental health concerns. So it's either dahil natatakot sila, stressed, anxious. There's so many reasons. And from that data lang, you can see na rin yung direct impact niya dun sa business. Na because of mental health concerns, nakaka-apekto and it's costing the company as well.
Si Richard naman, anong Richard pananaw mo dun sa parang disconnect between yung ibang generation, syempre yung mga boss dyan, yung iba dyan came from another older generation na hindi nakakaunawa pagdating sa mental health. Paano nyo i-bridge yung yung gap na yun pagdating doon sa sa mga hindi pagkakaunawaan?
Yeah, of course, it always boils down to education campaign, education and awareness. So we always need to educate everyone, educate, re-educate, learn, unlearn, and relearn things. If we want to bridge that generational gap between people, that's one thing that we can do. We can always try to educate each and everyone, even those, not just those who are in the older generations, but also in the younger generations. We have to re-educate everyone. Also, I think magandang rin dito is the communication. We always have to communicate with one another regarding our experiences, and not just communicate it, no? Hindi lang tayo makikinig, hindi lang natin pag-uusapan, but rather we have to be open about these things, because we have to understand that we are living in different generations and we have different experiences and different cultures na pinanggagalingan. So I think that's it. We need to educate, re-educate, and learn, unlearn, relearn, and as well as to communicate and listen carefully with each other.
Oh, how I wish na ganyan talaga yung nangyari. Yes. Yung listen carefully to each other, the ideal setting, and and not wait until it's too late. Okay. Oh, we haven't heard from you. Sino pa ba, hindi ba?
Sikat pa to?
Si Nikki.
Yes. So to add po dun sa mga na-share na po ng mga teammates ko po, no. Yes, in an ideal world, ang ganda po sana kung lahat ng tinuturuan natin ay ina-apply rin talaga kung ano yung natututunan nila. But in reality, we don't have control also over those things. Kaya ang isa sa mga urge namin also sa mga individuals is to also do a self-check-in. Ask yourself some questions like, example, is your workplace supportive of your mental health? Parang you also i-assess mo rin siya as an individual. Next, are conversations about mental health encouraged in the workplace, or parang mataas yung stigma, yung kailangan nyo magtago kung gusto nyo pag-usapan yung mental health? Do they still assist me when I need professional help? Is stigma actively addressed also in the company? What accommodations are in place for those with mental health conditions? And what support exists for returning after a mental health absence? So, some questions po na we can ponder on po, no, para alam natin if we're still in the right workplace for us as well.